Good morning. Good morning. I want to thank our Cook County Board of Commissioners who are here today. Let's start this way this time. Commissioner Monica Gordon, Commissioner Michael Scott, Commissioner Anthony Casada, Commissioner Alma Anaya, Commissioner Donna Miller, Commissioner Kevin Morrison, and Commissioner Bill Lowry. All right. Thank you all for joining us. And I understand they're all going to roll up their sleeves too. So, I want to thank our system leaders, our health system leaders, Dr. Eric Makaitis, who is interim CEO of Cook County Health, Dr. Claudia Fegan, who's our Chief Medical Officer, Dr. Lamar Hasbrook, who is Chief Operating Officer for Cook County Department of Public Health, Dr. Rosabel Diaz, Director of Inpatient Pediatrics. I want to thank all of them for their tireless work on behalf of our Cook County residents. We're here today to raise awareness about the importance of getting this year's flu and COVID shots. Vaccinations are an important part of healthy lives and healthy communities. Actually, you know, life expectancies over the last 100 years have increased considerably, and it's largely due to greater emphasis on sanitation, of course, but also vaccinations. Young people don't die of childhood diseases as much as they did in the past because we have vaccinations for a lot of them. And children and adults survive periodic flu bouts, flu pandemics, annual flus because of vaccinations as well. So we're very grateful to the scientists who have produced these vaccines and grateful to everybody who has the good sense to take them. We know that flu outbreaks can overwhelm hospitals and keep people from work and school. As we enter another respiratory virus season, we need to take advantage of the tools at our disposal to give ourselves the best chance at fighting these viruses. And we need to make sure that we're reaching the most vulnerable, which is why I'm especially grateful to the work of physicians up here for all they do to reach those often left behind in these conversations. While disparities still exist in vaccine coverage, as of May 2024, coverage for Hispanic adults and non-Hispanic Black adults trailed non-Hispanic whites. That's still true, but inroads are being made. So we have disparities, but the disparities are decreasing, so we're making some progress. Compared with the last year's flu season, Black adults were 6.5 percentage points higher for this flu season, while Hispanic adults were 6 percentage point higher. So we have more members of the African American and Latino communities who are challenged by the flu than we have in the white community, and we've still got a lot of work to do, as I said, around health disparities. Culturally tailored messaging and increasing access are important steps to continue to reduce this gap. We've got some real challenges. Getting vaccinated is an action all of us can take to protect our health and the health of those around us. I remember Dr. Raju, who was a previous CEO of our health and hospital system, whenever he went anywhere, he always talked about the importance of what he called herd health. Now, usually we talk about that with farm animals, but it's also true for people. You want to be healthy, but you also want the person you ride the bus or the train with, the person you meet in your office. You want everybody you come in contact to be vaccinated, to be in really good health, because that improves your chance of maintaining your own good health. So it's not only for yourself, but for everybody that you care about, everybody you come in contact with, that you need to be sure that you're vaccinated. I'm going to be getting COVID and flu vaccines today, and I hope all of you will join me in getting your shots as well. Now, we're going to take each of our county commissioners who wishes to speak. We're going to give them an opportunity to speak, and we're going to start this way this time. Commissioner Gordon was one of the last people to speak at our press conference yesterday, so she gets to be first today. I ask our commissioners to keep their remarks short, and if you would introduce the person who is immediately to your right, and we'll just go back this way, okay? All right, and Commissioner Gordon, while she is a county commissioner for the next several months, is about to become clerk of the court. We'll welcome her in that new position. Thank you.
Yeah.
Hi, everyone. I am Monica Gordon, Commissioner of the 5th District, which is the far south side and south suburbs, and I am elated to be here to speak about the importance of vaccines. As a former pharmaceutical rep and just someone who loves science, we got to continue to combat the misinformation that's out there. Science over conspiracy. Unfortunately, this is an opportunity to mitigate communicable diseases, preventable diseases. But unfortunately, we have people out there that say, oh no, the shot causes this, this will happen with the shot. And we really got to combat that messaging. Our vaccines are safe. Every year I get my flu shot and my COVID shot, which I will be getting today. And we know we're coming upon flu season. And also there has been a surge in COVID cases. So it's very important to sustain healthy communities, that we continue to communicate the safety of vaccinations. So thank you guys for being here today. I am excited to get my vaccinations, and have a great day. Thank you. And next I would like to introduce Cook County Commissioner Michael Scott.
Good morning. Again, my name is Michael Scott. I'm Commissioner of the 2nd District, home here to Cook County Health. Want to thank the President for her leadership. Unfortunately, this event happened probably about a week and a half too late. I had COVID about 2 weeks ago. But what I want to say is, last year I didn't have it. I had the vaccination, continued to get the vaccinations. First time I had COVID, and that is because I wasn't able to get the vaccination. So next time, if we do it a month earlier, hopefully I won't have COVID. But I can do that. But what I want to say is exactly what the Commissioner said. These vaccines are safe. They help prevent a lot of disease. And we want to make sure that we continue to promote and educate through our community. We want to raise that rate of individuals who get the vaccination within our communities and the Black and brown communities. And so that's why I'm here today, to raise that awareness. Again, President and Cook County Systems, thank you for your leadership. And now I would like to introduce a lame brain, one of my one of my favorite commissioners here, Commissioner Casado.
Thank you. Good morning. Yeah, it's a joke because of students who go to Lane Tech. It's an internal play. Good morning. My name is Anthony Joel Casada. I'm the Cook County Commissioner of the 8th District, representing the northwest side of Chicago. And just like my colleagues said, our vaccines are safe. They're scientifically proven. The data doesn't lie. I remember I got COVID at the beginning of the pandemic in March of 2020, and I felt miserable. And I also remember a lot of elder residents and vulnerable populations in my district who lost their lives, unfortunately. So to know that we made such incredible advancements and we were able to put out a vaccine as quickly as we did is nothing short of a miracle by scientific means. So we have the technology, we have the resources to keep people alive and to keep people safe. So please come out, get your vaccines, no matter your age, young, middle-aged or elder. Please come out. The vaccines are safe, they're proven, and take care of yourself, take care of your family, take care of your friends and your coworkers and your students who you work with. And let's keep living, because we deserve to have long and healthy lives. And our annual flu and COVID shot is a part of that health hygiene that we need so desperately in our communities. Thank you very much. And I'd now like to invite the Vice Chair of the Health and Hospitals Committee, Commissioner Alma Anaya.
Hi, good morning, everyone. My name is Alma Anaya. I'm the Cook County Commissioner of the 7th District and also proudly serve as the Vice Chair of the Health and Hospitals Committee. My district is just south of this, we're actually neighboring with Commissioner Scott. And during the pandemic, out of the top 5 zip codes throughout the pandemic that the state was reporting on COVID, consistently, at least 2 or 3 zip codes that are in my district were constantly at the top of that. And we have to remember, it's easy for us to celebrate and be really happy that we don't have the devastation that we had during the pandemic at the beginning, when it was very scary at times. But I mean, it's not just about having a runny nose and a cough here and there. It's about what was happening to individuals that had COVID. It's about the complications in their health. And I'm very proud that our health and hospital system has committed to continuing these vaccinations and to promote this and have a very active role in ensuring that people are vaccinated. And I'm even more proud that we believe in vaccinations and that we are actively working to ensure that the most vulnerable populations get the vaccines that they need to prevent further illness and further complications in our communities, and of course, further devastation. So I will also be getting my flu shot. I guess I joined you, Commissioner Scott, because around 2 weeks ago, unfortunately, I came down with COVID. But this is an important time for us to educate ourselves, but also our community and our family members and friends and loved ones. Hola, buenos días, me llamo Alma Naya, soy comisionada del 7º Distrito, también sirvo como la vicepresidenta del Comité de Salud y desafortunadamente hoy tenemos que recordar lo que pasó hace unos cuantos años, donde estábamos viendo la devastación que el COVID estaba causando en nuestras comunidades. Y es importante recordar qué fue lo que pasó, porque a veces es muy fácil ahora, ya que vemos todo abierto, olvidarnos de la devastación de las personas que se estaban enfermando y desafortunadamente que perdimos durante la pandemia. Y es nuestra responsabilidad como comunidad tener esas vacunas para prevenir más de nuestras comunidades y nuestros familiares y vecinos y personas que amamos, que se enfermen y que tengan esas complicaciones, porque desafortunadamente no es nomás una tos o no nomás es que tengamos y destornudemos, ¿verdad? Es realmente lo que puede causar en nuestras comunidades. So, estoy muy orgullosa que hoy día vamos a tener esta iniciativa y les agradezco mucho al sistema de salud porque tienen esta iniciativa y vamos a salvar vidas, ¿verdad? So, muchísimas gracias. And now I'd like to introduce Commissioner Donna Miller.
Thank you. Good morning, everyone. I'm Cook County Commissioner Donna Miller. I represent the south and southwest suburbs, and I'm so glad we're all here to talk about the importance of vaccines. I spent the majority of my professional career in the healthcare industry, focused on respiratory for over 20 years, and even called on Cook County Hospital many, many years ago. So I know the importance of the science of medicine, and we always say the value of medicine. And in the infrastructure and the words and everything that we focus on when we're talking about the science behind good medical practice and evidence-based medicine. Last month was actually Immunization Awareness Month, so that was a good time to remind everyone on why we should get immunized for all diseases, and for us here today, focus on the importance of the flu vaccine and COVID. In my district, they're still woefully under-vaccinated in many areas, and we need to raise the awareness for people because it's not just that you don't want COVID. You don't want COVID. If you do get COVID, the effects of long COVID are still affecting so many people in devastating ways that we have yet for the science to reveal what that means for people. And with school back in session, it's important to reiterate the getting inoculated for these diseases because we don't want our students to miss school like they did during COVID. That affected so many students. We're about to have the first the first graduating class last year was the first graduating class that was under the effects of COVID and staying home. So many kids are talking about that and how that affected every part of their life. Whether they were in high school, grammar school, or in college, we have a whole generation of students that are going to grow up knowing the effects of COVID and how that affected their schoolwork and their potential for many other things in their life. So I will be also getting my vaccine today for the flu shot, and we want to make sure that we are really combating the misinformation about vaccine that persists. And I think you can see by all of us being here today that we wholeheartedly believe in the science of medicine. So thank you for your attention. And next I will introduce Kevin Morrison.
Thank you so much. Good morning, everyone. Good morning. I'm Cook County Commissioner Kevin Morrison. I represent the northwest suburbs in the 15th district. You know, I made a little bit of news in 2020 when I became the first county commissioner to publicly disclose that I had been diagnosed with COVID. That was a horrific experience where I spent 4 days where every muscle in my body felt like broken glass. And I never want to live like that again. I was so incredibly excited when I had the opportunity to get my first Johnson & Johnson shot. That was the first vaccine I received. And I'm excited that today I will be getting another Moderna booster. I also am due for my flu shot, so I'll be getting 2 injections today. But I really want to thank President Preckwinkle, Dr. Makaitis, my colleagues, but more importantly, all the hardworking staff that work here throughout the Cook County health system. They are doing a public service, keeping Cook County residents healthy. And I also just want to say, the fact that Cook County Health has stepped up, working diligently to get shots in arms in order to prevent people from getting the coronavirus or the seasonal flu. I'm grateful for the work Cook County has put into vaccine awareness and making vaccines more readily available throughout communities far and wide throughout this very large county. Although we emerged from the pandemic, we cannot grow lax in promoting public health and doing everything we can to prevent the spread of potentially life-threatening diseases. Public health is a collective responsibility. It takes the efforts of everyone of us to keep our neighbors healthy. Vaccinations affect not only your own health, but the health of everyone in your life. That is why I look forward to receiving my own inoculations today and encourage everyone who is able to keep their own vaccinations up to date. Thank you again to President Preckwinkle and all the Cook County Health staff for making this event possible. And go get your shots. And with that, I would like to introduce the Vice Chair of the Finance Committee, my friend, Bill Lowry.
Thank you and good morning. It's so good to see all of you. I am Bill Lowry. I serve as Cook County Commissioner of the 3rd District, and one of the actual gems of the 3rd District is Provident Hospital. So while I love Provident, I also love Stroger, and I thank you for everything that all of you do on behalf of the entirety of Cook County. We're so fortunate to have your dedication. You know, I've often said that the primary role of a Cook County Commissioner is to take on the issues of today while building a bridge for a better tomorrow. And it is with these words in mind that I've joined my colleagues over the years as we have worked to increase accessibility to health care, including behavioral health care, to all in Cook County. It is with these words in mind that I'm here today to promote seasonal vaccinations. Now, I've never asked any of you to do something I'm not willing to do, so I actually have on a short sleeve shirt because I'm going to get both vaccinations today. And I think it's so important that we don't just ask others to engage in healthcare, but we model it, and that's what we're going to do today. I also want to acknowledge Cook County President Tony Preckwinkle and Cook County Health for your amazing leadership throughout the pandemic and for your continued leadership as we still are dealing with the vestiges of that horrific pandemic. Dr. King penned, "Of all the forms of inequality, injustice in health is the most shocking and inhumane. Today, we are modeling equality. Today, we are modeling humanity. And today, we are offering health care. To all of you, be safe, be blessed, get your vaccinations." It is now, thank you. It is now my pleasure to bring up our other leader, Dr. Eric Makaitis, Interim CEO, Cook County Health.
Okay, once again, good morning, everyone. Good morning. I want to start with a few words of thanks. First to President Preckwinkle for her stalwart support for Cook County Health and her commitment to health equity and access to care, including vaccinations. I'm also grateful for the support of the entire board of Cook County Commissioners, many of whom have joined us here today, and the CCH Board of Directors. In this time of scientific misinformation, it's incredibly important that everyone speak to the importance and efficacy of vaccines. Lives depend on it. We're fortunate that COVID and flu vaccines are readily available. Now it's a matter of reminding people about the importance of getting vaccinated. And while President Preckwinkle shared some encouraging numbers, I do want to shine a light on some of the opportunity. Only 54% of children and 48% of adults got last year's flu shot, and fewer than 15% of children and 22% of adults received the updated COVID vaccine last year. So we still have some opportunity. As we've seen during a recent surge of cases, COVID's not going away, and this flu season is already looking serious. Staying on top of your vaccine schedule is critical to preventing serious illness and death. If you visit vaccines.gov, that's .gov, you can find a location for flu, COVID, and RSV vaccine that's close to you. Here at Cook County Health, we are, as we've been for more than 180 years, available to those who need us regardless of ability to pay. Most insurance plans cover the full cost of routine vaccinations like flu and COVID, but we don't ever want cost to be a barrier for patients without insurance. Uninsured individuals can get their COVID or flu vaccine at any Cook County Health location free of charge. Anyone looking for a flu or COVID vaccine can call 312-864-0200 to make an appointment for a vaccine. That's 312-864-0200. We were proud to be here when people needed us the most, and as a doctor, I know that vaccines are safe and effective. They're our best bet to staying healthy this winter and beyond. If you've been on the fence, take this as the sign. The time is now. Make a plan. Get vaccinated. We're rolling up our sleeves today to get our shots. Thank you. It's now my pleasure to invite to the podium Dr. Lamar Hasbrook, Chief Operating Officer for Cook County Department of Public Health.
Thank you, and good morning.
Good morning.
Let's see here. So I'm Dr. Lamar Hasbrook, and I lead the Cook County Department of Public Health, where we are in the business of building healthier communities. And the first thing I want to say, because so much has been said about this topic, is congratulations. And by that I mean you're still here. And by that I mean you survived last year's flu season. Many people did not. We're up to 1.2 million deaths from COVID. Every year, tens of thousands of folks die of the flu. So congratulations, you made it through last flu season, but that was last flu season. There's no magic bullet in terms of you making it through this year's season without getting your vaccines and doing everything you can possible to increase your rate for survival. And as has been mentioned with the statistics, Americans just don't like to get vaccinated for some reason. What you need to know is that last year's vaccine, that's done. This year, there's a new vaccine for the new strains of the virus in circulation, and this is the vaccine that you need to get. You need to get this year's flu vaccine because the flu this year is different than last year. You survived it. Again, congratulations. You need to get the new COVID vaccine because COVID is different this year because of the strains have been changing and mutating. So you need to get that as well. So we want to encourage you to avail yourselves of these things and make sure you pull someone along with you. I'm probably speaking to the to folks who already believe in vaccinations, but I want to encourage you to pull somebody along with you. Just yesterday, my brother, who's just a year older than me, and I've been a physician and public health practitioner for 30 plus years. He said, make sure you avoid those jabs. So I say that to say we all have friends and family members and folks who believe in conspiracy theories, who don't believe in the vaccine, who want to avoid it with all that they can. But from a scientific standpoint, from a public health standpoint, from a population health and community health standpoint, it is the best thing you can do and the most powerful thing you can do to make sure you survive this year's flu season. So with that, I'm going to turn the mic over to Dr. Rosabel Arcia Diaz, Director of Inpatient Pediatrics. Thank you.
Good morning, everyone. Good morning. Thanks for having me here. I'm a pediatrician here at Cook County Health, and I'll be giving the remarks in Spanish to connect with our population in the Latino community. Buenos días. Soy la doctora Rosibel Arcia Díaz, directora de pediatría para pacientes hospitalizados en Cook County Health. El año pasado, solo el 53.9% de los niños y el 48% de los adultos recibieron la vacuna contra la gripe. La vacuna contra la gripe se ha administrado de forma segura durante décadas. Es importante reducir las enfermedades gripales, las visitas al médico, las ausencias laborales y escolares y reducir el riesgo de hospitalizaciones y muerte relacionada a la gripe. Seguimos viendo el impacto de la desinformación sobre las vacunas en nuestros niños y eso es muy preocupante. El 13 de septiembre, los Centros para el Control y la Prevención de Enfermedades informaron dos nuevas muertes infantiles relacionadas con la gripe este mes, lo que eleva el total para la temporada de gripe del 2023 al 2024 a 199. Las 199 muertes es el mismo número que vimos durante toda la temporada de gripe del 2019 al 2020. También sabemos que menos del 15% de los niños y el 22% de los adultos recibieron la vacuna COVID actualizada del año pasado. Da miedo pensar que la mayoría de las personas llegan desprotegidas a la temporada de COVID y de gripe. Como médico necesito contarle los hechos. Y cada año ingresamos a niños en el hospital por gripe, por COVID, y es increíblemente aterrador para las familias ver a sus hijos luchar por respirar. El hecho es que podemos prevenir enfermedades graves y muertes con la vacunación. Necesitamos que todos se vacunen para proteger su propia salud y sobre todo la de quienes nos rodean. Les pido a todos que conversen con el médico de su hijo sobre la importancia de las vacunas para que no nos quedemos aquí el año que viene discutiendo sobre otros niños que mueren a causa de virus respiratorio para los que hay vacunas disponibles. Gracias por su atención. Thanks, everyone.
All right, do we have any questions? Dr. Makaitis?
Actually, I would ask Lamar.
All right. Dr. Hasbrook.
So this is I would say probably a year-round full court press. We amp it up during flu vaccine. We have a campaign called Boost Up Cook County, boostupcookcounty.com, where folks can get all the information about vaccinations, not only just for COVID or flu, but RSV and other vaccine-preventable diseases. So that's kind of an evergreen campaign, an educational campaign. So the only way you can combat misinformation is with good information from good spokespersons, credible spokespersons like everyone here on the platform today. Thanks.
So I think that speaks to, right, that hesitancy, the misinformation that we've been speaking about all morning. I think the opportunity, as Dr. Hasbrook said, is to get out there, engage the community, right, and keep talking about it and show that others in the community are also getting vaccinated, right? It should start kind of creating that momentum. So, Can I add to that? Yeah, oh, please. Okay. Yeah.
So there's also this mythology that if you've had it before, you're good. So I had it before, I had COVID before. Many of us have had COVID several times. And actually, that's even more reason to get vaccinated, because those folks who go into long COVID, which is the long-term complications, it actually gets worse with repeated COVID infection. So there's that piece that I've survived it last time, I'm going to survive it this time. Oh, I've had COVID, so I'm immune. All that's out the window. Every year, there's new strains in circulation. Every year, you need to take the new vaccine.
Thank you. So, just a second, I want to say one thing. You know, so I'm a history teacher, and I said in my remarks that we've been able to prolong life in our country and around the world, largely because we've improved sanitation and because we've been able to provide vaccines to people. Unfortunately, that's a history that not all of us appreciate or are aware of. So first we have large numbers of people who don't appreciate how far we've come in terms of life expectancy and general good health while we're on this planet. And then we have folks who have engaged in deliberate conspiracies to discourage people from getting vaccinations. And many of our commissioners spoke to the importance of looking to science rather than myths or conspiracies. And I would just say, you know, if you look at the science, the reason that we have the life expectancies we do is in due large part to vaccinations, not just for childhood diseases, but for things like the flu. And if we, if we want to protect ourselves and the people we love, we need to be vaccinated. That's, if you just look at history, that's the case. I realize as a history teacher, not everybody loves history the way that I do. But if you read any history, it's readily apparent that that's the case. So. Any more questions?
I have one more. There's a clinical trial currently of a combination flu and COVID vaccine. Do you have any updates on when that might be available in Cook County?
I have no idea. We don't know. Introduce yourself, please.
Claudia Fegan, Chief Medical Officer for Cook County Health. We don't know when it's going to be available, but we're hoping, we think that that will improve the vaccination rate when people can get one shot and get covered for both. But we're not sure when they'll be commercially available.
Something to look forward to. Anything else? All right. Yeah, we got to roll up our sleeves. Where are we going?